I'm Dr. Smita Ramachandran. I'm a pediatric and adolescent endocrinologist. Today I want to take up the question which I'm most frequently asked by diabetic parents is, what is a diabetic diet for children with type 1 diabetes? So my answer as a blanket answer all the time is there is no diet in type 1 diabetes. But then how do we give the insulin? So what you need to do is we need to give insulin according to carbohydrate counting. What does that mean? It means we decide the dose of the insulin depending upon the carbohydrates in the food and dose it accordingly. What this leads to is that your blood sugar for the meal is covered and does not rise very high. So the next question that comes is, what all constitute as carbohydrates in the diet? Common ones we all know. All roti, wheat, bajra, ragi, all the cereals constitute carbohydrates. All fruits which are sweet constitute as carbohydrates. We need to give insulin. There are certain vegetables, high starchy vegetables, dals, lentils, peas. They also require insulin to be given. Any child or adolescent who is type 1 diabetic on insulin, whether multiple doses daily or an insulin pump, who is willing to count the carbohydrates in the diet can use carb counting. So how do you count your carbs? For carb counting, there are three important parameters: your target blood sugar levels, your insulin to carbohydrate ratio, and your insulin sensitivity factor. Your endocrinologist will sit with you and calculate these three parameters based on your child's total daily requirement of insulin. So insulin to carbohydrate ratio will be how much 1 unit of insulin will bring down carbohydrates in grams. Your insulin to sensitivity factor will be how much 1 unit of insulin will bring down your blood sugar values. Once you have these values, they will help you to calculate your carbs based on how much food you're eating and titrate your dose of insulin accordingly. How does carb counting help you? So carb counting helps you in a big way. It will help you decide your meal and how much of a rise in blood sugar is to be expected from that meal. Once you know that, you can adjust your dose of insulin accordingly and keep your blood sugars in normal range. When you're doing this on a daily basis and your sugars are normal, this eventually helps you to bring your HbA1c in range and thus prevent any complications which are associated in type 1 diabetes due to high sugars. So carb counting is a balance between your food intake and your insulin dose to maintain your blood sugars in normal range.